7 lakh people, actually more than that, die due to suicide every year. Suicide due to depression is the fourth leading cause of death in 15 to 29-year-olds. 280 million people in world have depression. 3.8% of the population experience depression, out of which 5% are adults and 5.7% adults older than 60 years, as per the World Health Organization. As per a 2015 Indian survey conducted by National Mental Health, 1 in 20 Indians suffer from depression. According to this survey, India has over 258,000 suicides in 2012, with the age group of 15 to 49 years being most affected. Lots of medicines to treat depression, and on top of it, health supplements with true and false claims. 656 million US dollars is the revenue of mood support supplements market, and it was back in 2022. By the end of 2033, the market is expected to reach a valuation of 1.3 billion US dollars. In the past decade, there has been a meteoric rise in the number of food and dietary supplements claiming their benefits to treat depression. Crocus sativus, also known as KESAR, is also being claimed as an antidepressant and as powerful as fluoxetine, commonly known as Prozac, which is a selective serotonin reuptake inhibitor. The main focus of today's talk will be Crocus sativus, also known as KESAR in Hindi, and the claim for its antidepressant activity is on our radar. I am Amit Deshpande and you are with Medical Mysteries. In a few moments from now, I will present you an unbiased evaluation of the antidepressant claims of KESAR. So stay tuned and watch till the end. Saffron is a spice derived from the flower of Crocus sativus, commonly known as the saffron crocus. The vivid crimson stigma and styles, which are also called threads, are used as a seasoning and coloring agent in food. Saffron contains around 28 volatile and aroma yielding compounds dominated by ketones and aldehydes. Saffronal is the main aroma active compound present in saffron. Although some doubts remain on saffron's origin, but it is believed that saffron originated in Iran. And all the clinical trials I will be presenting today are also originating from Iran. 2005. Rusbeh Hospital, Tehran University. A clinical trial correlating KESAR and depression titled Crocus sativus in the treatment of mild to moderate depression. A double-blind, randomized and placebo-controlled clinical trial. 40 adult outpatients participated in this trial who met the Diagnostic and Statistical Manual of Mental Disorders and categorized as DSM-4 participated in this trial. Patient had a baseline Hamilton rating scale for depression score of at least 18. In this double-blind, placebo-controlled, single-center and randomized trial, patients were randomly assigned to receive a capsule of saffron, 30 mg per day, or a placebo capsule for 6 weeks. This trial concluded that after 6 weeks of KESAR treatment, KESAR produced a significantly better outcome on the Hamilton Depression Rating Scale than the placebo. That means KESAR or saffron has antidepressant properties. In 2007, University of Tehran in Iran launched a clinical trial to study KESAR or saffron and depression titled Comparison of Petal of Crocus sativus L and Fluoxetine in the Treatment of Depressed Outpatients, a pilot double-blind randomized trial. These scientists wanted to compare the efficacy of saffron with fluoxetine in the treatment of depressed outpatient in an 8-week double-blind randomized trial. 40 adult outpatients who met the DSM-4 criteria for major depression based on structural clinical entry for DSM-4 participated in this trial. Patient had a baseline Hamilton rating scale for depression score of at least 18. In this double-blind and randomized trial, patients were randomly assigned to receive 15 mg KESAR capsule twice a day and fluoxetine, also known as Prozac, 10 mg twice a day for 8 weeks. At the end of the trial, KESAR was found to be as effective as fluoxetine in the treatment of mild to moderate depression. In addition, both the treatments, the remission rate was 25%. There was no significant differences in the groups in terms of observed side effects. This study very well confirms that KESAR or saffron is as good as fluoxetine in the treatment of depression. One more trial in 2016 studied the connection of KESAR or saffron with depression and anxiety. The study was titled a double-blind, randomized and placebo-controlled trial of saffron, Crocus sativus or KESAR, in the treatment of anxiety and depression. 60 adult patients with anxiety and depression were given 50 mg saffron capsule twice a day for 12 weeks. Beck Depression Inventory, also known as BDI, and Beck Anxiety Inventory, also known as BAI, questionnaires were used at baseline 6 and 12 weeks after initiating medication. The result of this clinical trial very well conclude and confirms that saffron supplements had a significant effect on BDI and BAI scores of subjects in comparison to placebo at the 12-week time point. Further, the report comments that saffron appears to have a significant impact in the treatment of anxiety and depression disorder, and also comments that side effects were rare. So, under the light of these three clinical trials, we can very well conclude that KESAR 30 to 50 mg daily could be very effective to treat and manage depression. But please do consult your doctors if you're already undergoing a treatment or experiencing symptoms of depression. So that brings us to the end of today's story. Coming up is a delicious KESAR milk recipe, so don't miss that part. For more health related information strongly backed with scientific proofs, please do subscribe this channel. Thanks for watching. Have a great day ahead. Thank you.